Disorders of heart valve. Disorders of the heart valves refer to conditions in which one or more of the heart's four valves do not function properly. These valves play a crucial role in regulating blood flow through the heart by ensuring that blood moves in one direction. There are several types of valve disorders, and they can affect the valves in different ways. Here are some common disorders of the heart valves. 1. Valvular stenosis. Valvular stenosis is a heart valve disorder characterized by the narrowing or constriction of one of the heart's four valves, which can impede the normal flow of blood through the heart. There are four valves in the heart: the aortic valve, the mitral valve, the tricuspid valve, and the pulmonary valve. Stenosis can affect any of these valves, but the aortic and mitral valves are the most commonly affected. Aortic valve stenosis, narrowing of the aortic valve, which separates the left ventricle from the aorta, the main artery carrying oxygenated blood from the heart to the body. Mitral valve stenosis, narrowing of the mitral valve, which separates the left atrium from the left ventricle. Causes of valvular stenosis. Congenital defects. Some individuals are born with heart valves that have abnormal shapes or structures, leading to stenosis. Calcification. Over time, calcium deposits can accumulate on the valve leaflets, causing them to become stiff and narrow. This is particularly common in the aortic valve and is often seen in older adults. Rheumatic fever. Untreated streptococcal throat infections, such as strep throat, can lead to rheumatic fever, which may cause inflammation and damage to heart valves, resulting in stenosis. Infective endocarditis. Severe infections of the heart valves can lead to valve damage and stenosis. Other causes. Stenosis can also result from radiation therapy, certain medications, or other underlying heart conditions. Symptoms of valvular stenosis. The symptoms of valvular stenosis depend on the valve affected and the severity of the narrowing. Common symptoms may include chest pain or discomfort, fatigue, shortness of breath, especially during physical activity, heart palpitations, feeling of rapid, irregular heartbeat, fainting or lightheadedness, swelling in the ankles, feet, or abdomen, edema. Treatment of valvular stenosis. The treatment of valvular stenosis depends on several factors, including the severity of the condition, the valve involved, and the patient's overall health. Medications may be used to manage symptoms, such as reducing fluid buildup and controlling blood pressure. Valve repair or replacement surgery is often necessary for severe cases of stenosis. This can involve repairing the valve or replacing it with a mechanical or biological valve. Minimally invasive procedures like balloon valvuloplasty can be used to treat some cases of valvular stenosis by widening the narrowed valve opening. In mild cases or when surgery is not an option, close monitoring and regular follow-up with a cardiologist may be recommended. 2. Valvular regurgitation. Valvular regurgitation, also known as valvular insufficiency or valvular incompetence, is a heart valve disorder characterized by the leaking or backward flow of blood through a heart valve that does not close properly. There are four valves in the heart: the aortic valve, the mitral valve, the tricuspid valve, and the pulmonary valve. Valvular regurgitation can affect any of these valves, but the mitral and tricuspid valves are more commonly affected. Aortic valve regurgitation, backflow of blood from the aorta into the left ventricle. Mitral valve regurgitation, backflow of blood from the left ventricle into the left atrium. Tricuspid valve regurgitation, backflow of blood from the right ventricle into the right atrium. Pulmonary valve regurgitation, backflow of blood from the pulmonary artery into the right ventricle. Causes of valvular regurgitation. Valve damage, damage to the valve leaflets, chordae tendineae, tendinous cords that anchor the valve leaflets to the heart muscle, or papillary muscles can lead to valvular regurgitation. This damage can result from various causes, including infection, endocarditis, rheumatic heart disease, or injury. Valve prolapse. Valve prolapse occurs when the valve leaflets bulge or collapse back into the atrium during the heart's contraction, allowing blood to leak through. Mitral valve prolapse, MVP, is a common example. Dilatation of the heart chambers. Enlargement of the heart chambers can stretch the valve annulus, the ring-shaped structure that supports the valve, preventing the valve from closing tightly. Congenital valve abnormalities. Some individuals are born with structural abnormalities in their heart valves that predispose them to regurgitation. Symptoms of valvular regurgitation. The symptoms of valvular regurgitation depend on the valve affected and the severity of the leakage. Common symptoms may include fatigue, shortness of breath, especially during physical activity, palpitations, feeling of rapid, irregular heartbeat, swelling in the ankles, feet, or abdomen, edema. Heart murmurs, abnormal heart sounds, are detected during a physical examination. Treatment of valvular regurgitation. The treatment of valvular regurgitation depends on several factors, including the severity of the condition, the valve involved, and the patient's overall health. Medications may be used to manage symptoms, such as reducing fluid buildup and controlling blood pressure. Valve repair or replacement surgery is often necessary for severe cases of valvular regurgitation. This can involve repairing the valve or replacing it with a mechanical or biological valve. Minimally invasive procedures like percutaneous valve repair or replacement may be an option for some patients. In mild cases or when surgery is not an option, close monitoring and regular follow-up with a cardiologist may be recommended. 3. Valve prolapse. Valve prolapse, also known as mitral valve prolapse, MVP, when it affects the mitral valve, is a heart valve disorder in which one or both of the valve flaps, leaflets, of the heart's mitral valve bulge or collapse back into the left atrium when the heart contracts. This can lead to improper sealing of the valve and, in some cases, regurgitation or leakage of blood from the left ventricle back into the left atrium. Mitral valve prolapse is the most common type of valve prolapse, but other valves can be affected as well. Here's an overview of mitral valve prolapse and its key aspects. Causes of mitral valve prolapse. The exact cause of mitral valve prolapse is not always clear, but it is believed to result from a combination of genetic, environmental, and structural factors. In some cases, it may be associated with connective tissue disorders, such as Marfan syndrome or Ehlers-Danlos syndrome. Symptoms of mitral valve prolapse. Many individuals with mitral valve prolapse are asymptomatic and may not even be aware of the condition. When symptoms do occur, they can vary widely and may include chest pain or discomfort, palpitations, feeling of rapid, irregular heartbeat, fatigue, dizziness or lightheadedness, shortness of breath, especially during physical activity, anxiety or panic attacks. Treatment of mitral valve prolapse. Most individuals with mitral valve prolapse do not require treatment, especially if they are asymptomatic or have mild symptoms. For those with significant symptoms or complications such as mitral regurgitation, leakage of blood through the valve, treatment may be necessary. Treatment options can include medications to manage symptoms or prevent complications. Valve repair surgery. This may involve repairing the valve leaflets or, in some cases, replacing the valve. Regular monitoring. For individuals with mild or asymptomatic mitral valve prolapse, periodic follow-up with a cardiologist to assess valve function and any changes in symptoms may be recommended.